Good evening, Furbo family. Welcome to Grocery. Today, as I stand here, I represent the countless young women across St. Lucia, those who dream of a better future, those who work tirelessly to achieve it, and those who unfortunately face a healthcare system that is failing us. Let me start by asking a question. What has the St. Lucia Labour Party done for us in terms of healthcare? In case you did not know, let me remind you. They stopped the commencement of the National Health Insurance Program. They falsely introduced a health and security tax to fund healthcare, yet the budget for healthcare was cut. Constant shortages of basic medication and healthcare facilities island-wide. Mass resignation of doctors and staff at the Owen King European Union Hospital. They abandoned the state-of-the-art St. Jude's Hospital, which was started by the UWP. SLP managed COVID for 1 year with over 400 deaths. And in case you forgot, the United Workers' Party managed COVID for 2 years with only 80 deaths. Healthcare should be a backbone for any striving nation. It is the foundation that allows us to live well, but in St. Lucia, that foundation has become weak, fragile, and unreliable. For too long, we have been forced to navigate a healthcare system that feels more like a game than a service. As a young woman, I have seen firsthand the consequences of a broken system. From my family members to my friends and even myself. Going to a health center or hospital is just not a routine part of life, it is a source of fear. Will there be a doctor available? Will there be enough medication? Will there be any equipment that works? These are the questions we should not have to ask in 2024. Yet, they remain a daily reality for many of us. Let us start with access. St. Lucia's healthcare is supposed to be for all of us. Yet, for many of us, it feels like a privilege rather than a right. I have seen people struggle to get basic medical care. And for some, the facilities are too far, the transportation costs too high, and even when they finally reach a hospital, there is often no guarantee that they'll receive the service that they need. Then there is the state of facilities themselves. I've walked into some of our clinics and our hospitals and felt like I was stepping back in the time of my grandparents. Broken beds, outdated equipment, peeling out walls, long lines in the corridor, no medication, doctors outsourcing from patients themselves. Our healthcare professionals, many of whom are incredibly dedicated, are being asked to perform miracles within limited resources. And let me tell you, no one, no doctor, no nurse, no patient should be going through this. We the youth, and we are the future of this nation. Yet, we need healthcare, and it is as if our futures are not considered a priority. Maternal health services, mental health care, preventative screenings, these are basic things that the young women like me should have access to without delay or anxiety. But in St. Lucia, it feels like we are asking for too much. 2 or 3 weeks ago, a friend of mine, a young woman, who suffers with a condition that requires special care, visited the hospital. And you know what she received? A long wait. She spent the entire day in the hospital and left in the night with no clear path to treatment. In fact, given a known diagnosis, she was given a prescription to buy some pills and sent home. It was heart-wrenching to watch her battle, not just her illness, but also a system that was supposed to protect and care for her. And she is not alone. She is not the only one who may have this a very, and if not close story. These stories echoes in the lives of many people in St. Lucia. Now let's talk about mental health. I know how crucial it is for us to have access to mental health support, especially in a time when stress, anxiety, and depression are increasingly common in the youth. But in St. Lucia, mental health services are barely spoken of, let alone adequately funded. How many more of our young people must suffer in silence before we acknowledge that this is a crisis? Truth is, we deserve better. We deserve a healthcare system that works. We deserve doctors who are available, clinics which are equipped, and services that are reliable. We deserve mental health care that is accessible and affordable. We deserve a government that treats healthcare as a moral obligation. To those in power, I say this. The state of healthcare in St. Lucia is a direct reflection of your priorities. When our people suffer, when young women like myself are forced to question whether we'll get care if we need, this is a failure of your leadership. You've already destroyed our agricultural sector. Must we now watch you dismantle our healthcare system too? We are tired of waiting. We are tired of excuses. And we are tired of seeing our people, especially our young women, being left behind. It is time for action. It is time for accountability. Now, I know y'all are not familiar with the meaning of that word, so I looked it up for y'all. Accountability, a noun. The quality or state of being accountable, especially an obligation or willingness to accept responsibility for one's actions. It is time for you to truly care about the health of this nation. We, the young women of St. Lucia, are calling for change, and we will not stop until we see the change. Thank you.